Welcome to the Patient Educators Update, where we focus on patient educators and patient education topics in a clinical environment. My name is Chuck Jones, and our guest today is Fran London. Fran is the health education specialist for Phoenix Children's Hospital in Phoenix, Arizona. She has published dozens of articles and 2 books on patient education, including No Time to Teach, The Essence of Patient and Family Education for Healthcare Providers. This book has been awarded the 2010 Book of the Year Award by the American Journal of Nursing. Hi, Fran. Welcome.
Hi, Chuck. Thank you.
So how's everything? You doing well?
Oh, yeah.
How's the weather in Phoenix?
Warm.
That's probably a common refrain. Well, hey, our topic today is, I think, one of your favorite topics when it comes to education, and that is teach back. And that was a topic that wasn't a specific chapter in your book, but really something that was woven all throughout No Time to Teach. So could you spend a little time today and tell the audience, what is teach back?
Oh, I'd love to. Teach back is the most underused tool in healthcare today, and it's so effective. Basically, it's asking the patient to teach back to you what it is they understand, and it can be used both as assessment to find out what they know before you start teaching, or as evaluation of understanding to see if they understand what it is you did teach them.
Okay, well, that makes sense. Well, when should you use teach back?
I use it all the time.
Okay.
Basically, anytime you interact with a learner, of either a patient or a family member, just ask them, what do they know about whatever it is?
Okay, so you as you said earlier, you almost use it as an assessment tool as well.
Yeah.
Because then that helps you understand what they understand.
Exactly.
Yeah, and as we've talked about in a previous show where we were talking about assessment, you really can't teach if you don't know where they are in the understanding of their situation.
Yeah, you lose them if you don't start where they are.
Yeah, okay, that makes sense. Well, is there anything special about how teach back should be used, or can you give us an example of how
Yeah.
it okay.
I think the key point about teach back that people most likely misunderstand is that it's not a test to see what the learner knows. It's really to see what it is they do know. Then you can work with that and fill in the gaps or correct misunderstandings. And then it's also a way to evaluate whether what you taught was clear to them.
Okay, that makes sense to me because I can tell you from experiences with both my wife and my mother in the hospital, when the doctor or the nurse was in there to discuss a particular topic, I heard it one way and they heard it a different way. And so when they leave, we have this discussion about what was discussed. And one of the common things that I noticed is that not the patient, but the nurse or the doctor, when they would talk about it, they would just go, "You understand?" And of course, everybody goes, "Sure," not wanting to be stupid that they didn't understand. So then the doctor or the nurse leaves, and we look at each other and go, "Well, what did you take from that?" So is that pretty common?
Absolutely, absolutely. And
Okay,
what's worse is in the moment, the learner may understand or think he or she understands, but then they get home and it's like, I don't know what to do.
Yeah, I can totally relate to that. Well, speaking of getting home and even before discharge, let's say that you've used teach back early on. Do you follow up on the same thing? To see if they've retained it? Is there a good way to follow up?
Absolutely. Yeah, it's good to just make sure that basically reviewing the important points. What are the key issues that could come up? Do they know what to do, how to recognize them, how to respond? Do they know who to call? The important points, just get them to teach that back to you.
Sure, that makes sense. And of course, you typically include the family member if there's one handy in this same process, I would assume. Now, let me ask you this. Is there one best way to either do teach back or follow up? In other words, is it like a process? Do you do the same thing with every person, or is every patient different in terms of how you handle teach back?
Good question. It's really an interaction, a conversation. So you do it within the context of who you're talking to. Sometimes it helps to say, instead of tell me what you know, is if you were going to teach that to your husband, how would you explain it to him? That's another way to get the same response.
Okay. All right. Well, that makes a lot of sense. So I think what you're telling everybody is that when you're doing teach back, it's not the same words delivered in the same manner to every patient that you talk to, but it's very much about connecting to the patient and understanding their situation first, and then incorporating teach back as part of the overall education process.
Perfect. Yes.
Okay. So the end goal is when you start education, when the patient basically is admitted, the overall plan is to build on their education up until the time that they're discharged. So
Absolutely.
that they have cumulative learning, and teach back is one of your favorite tools for that.
Yes.
And as you pointed out, probably one of the most underutilized. And I will tell you that going back to when you and I first met online more than a year ago, I never heard the term until you started using it, but I see it more and more where people are writing about it. I don't know if they are just glomming onto it because it's something new or fancy they heard somewhere, or if it's, something that they deeply understand like you do. But I guess from your benefit, you don't care, do you?
No, there's a lot more research out indicating that is effective.
Okay,
it saves
that's
a
cool.
lot of time.
Wonderful. Well, that's something we'll have to talk about. Given that the title of the book is No Time to Teach, in a future episode, we need to talk about using the research and showing how it saves time, because a lot of people will think that, I've got too many charts to fill out and too many meds to give out. I don't have time to teach. Okay.
Yeah, we'll have to talk about that.
Okay. All right. We definitely will. Well, I tell you what, I have a much better understanding of teach back based on our conversation today, and I hope our audience does as well. And I'm sure it'll be something we'll touch on in other episodes. So I want to thank you for your time today. So we'll close up the show, and I'll talk to you again next week, okay?
Okay, thanks, Chuck.
Okay, thanks to our guest, Fran London. She is the author of No Time to Teach. Her book is available wherever books are sold in both paper and ebook form, so check out Amazon or your favorite book supplier. And all you hospitals out there, for quantity purchases, you can save 40% directly from her publisher, Pritchard & Hull, and visit their website, p-h.com. And we'll also put some notes, some links to these locations in the show notes so you can check that. And you can also follow Fran on a regular basis on her blog, which she updates quite frequently. It's called notimetoteach.com. And be sure and leave a comment. And then you can follow her on Twitter. She's very active there, and her Twitter handle is @notimetoteach. And let's see here. So the Patient Educators Update is brought to you by Synergy Broadcast Systems and our Education on Demand system, MMDS, that provides video-based patient education to help patients and their families prepare for a successful discharge and home health care after leaving the hospital. You can find out more about MMDS and Video on Demand on our website, synergybroadcast.com. Thanks for watching.